Hi, my name is Dr. Jennifer Marrone. I'm a certified OBGYN working in Southport, Connecticut. I'm part of PWH and I'm here today to talk to you a little bit about emergency contraception and unwanted pregnancy if your contraception is unreliable or has failed you. So my utmost importance is to really iterate how important it is for contraception to be available and to be discussed, and how important it is to get on the right contraception that's right for you. Every woman is different and every person is different. And what works for you might be very different than what works for somebody else. Now, some women do choose to use contraception and some don't. It is everybody's right and option to be able to choose a contraception that's working for them. We have a lot of different types of contraception that are on the market these days that work wonderful. And sometimes they can be unreliable for many reasons. So some of the contraception that we have on the market today can consist of a NuvaRing, the patch, the pills. There's also gels that can be inserted into the vagina within an hour of unprotected intercourse that can stop and inhibit immobilization of semen. We have Depo-Provera injections and IUDs, long-acting contraception that can be used for many years that we don't have to worry about taking, and also the Nexplanon rod that is inserted in the upper arm. Obviously, we like to think of contraception as an option, an opportunity for everybody to be able to control their own bodies in the way that they choose to. I feel that I'm here for my patients, and I'm always a phone call away for that conversation, and to also for, to guide them into what is the best option for them. Now, regardless, I think condoms are great. On top of all these options that I've just spoken about, I think that condoms are wonderful. They really do try to help protect you against, unwanted sexually transmittable diseases. And I think that condoms are also important to inhibit unwanted pregnancy. So I think that condoms are always a good choice, especially for the younger population as well. I think that sometimes it's hard to plan when we're going to have sex and, if we're going to have sex. So always having condoms around is a really great option. So here we are today, and we are going to talk a little bit about, if our contraception has failed us for many different reasons. But if it's not reliable, again, if you are not taking the pill the right way, or not doing your patch the right way, or the ring the right way, if the ring has come out within those 2 hours of time that it might have come out, you can use it and it should be very reliable. If it's been longer than that, it sometimes can be unreliable, and emergency contraception might be needed. If you are using a birth control pill and you forget to take it because life happens, and or if you're on different medications, and sometimes those different medications, even antibiotics, can also help decrease the efficacy of a birth control pill, meaning that it doesn't allow the birth control pill to work very well. Sometimes if you're on different medications, you can have different interactions with your hormonal contraception. So you have many reasons for having a contraception that could be unreliable or fail. And if it does, what do we do? The first thing we do is we call our OBGYN, call your provider. The sooner, the quicker you do, the better we can help you, okay? There's options out there, but we really, really do need to have you call us within a certain amount of period of time so that we can really kind of give you all of the options that are available these days. Nothing, okay, can protect you from an STD, okay? No emergency contraception is going to protect you from getting gonorrhea or chlamydia or any other type of STD. So you definitely want to come in and get checked and treated for any kind of exposure that might have happened. So that's just off the topic of just having an emergency contraception for unwanted pregnancy. So when we talk about unwanted pregnancy and we talk about an unwanted, conception of pregnancy, we talk about this emergency contraception that's available in the United States today. So when we have two separate baskets of options, we've got a basket that is basically pills, and another basket that's really kind of more along the lines of an IUD, intrauterine device that could be inserted within 5 days from unprotected sex. So we have pills. The first pill is very well known. It is called Plan B, and Plan B is over the counter. You don't need a prescription. You can get it right away, and you can go to a pharmacy and you just can get the Plan B and ask for it. It is one pill, one time, in 72 hours from unprotected intercourse. You take your one pill within that 72-hour period and call your physician even after you've taken it. When you do that, it is about a 95% effective, meaning 95% of the time it is going to inhibit you from getting an ovulatory cycle. Now, what does that mean? Ovulation is really something that should be taking place every month. Many contraception devices and options out there are stopping and inhibiting ovulation from occurring. So pregnancy, you need an egg and you need sperm. Ovulation means women are producing an egg and releasing it. It's coming out there, it's available, and it's waiting for sperm. What the birth control pills do, and what the patch does, and the NuvaRing does, and even other devices, is it actually stops you and inhibits you from ovulating. And that's how they work as birth control. The next choice is basically 2 pills, and you do need a prescription for it, so it is a little bit different than the Plan B. Plan B is super easy, but next choice is really not as easy. Next choice, you need a prescription, you need to take a pill, and 12 hours later, take another pill. That's usually the way that that's prescribed. That's, again, really effective if you're taking it within 72 hours from the time you've had unprotected intercourse. Your third option is called Ella. Ella works a little bit differently, but again, it works by decreasing your chances of ovulation. The other option is called the Paragard IUD. And that Paragard IUD is an intrauterine device, which is a little copper IUD, which is a copper T that sits inside the uterine cavity. That little copper IUD that sits in the uterine cavity is going to be inserted within 5 days of unprotected intercourse, and that's going to make a very harsh environment for any kind of implantation to occur. So here you go. You've got a few options of emergency contraception. Always call your OBGYN, and we always look forward to having a conversation with you about what's the best option for you to have the best contraception device or the best contraception that you possibly can use. And we're always here for you. We're a phone call away, and we're always willing and wanting to answer any of your questions. So I hope that this is helpful, and take care and have a great day.